If we switch gears and we talk a little bit about Tucatinib, the registrational trial that Tucatinib was approved off of was called HER2 Climb. And this randomized patients either to capecitabine, trastuzumab, and placebo, or capecitabine, trastuzumab, and Tucatinib. Patients really were third-line patients. They had seen what was commonly taxane, trastuzumab, and pertuzumab in the first-line space, and then seen TDM1. So really more of a common third-line trial. Again, they were positive for progression-free survival, for overall survival, for progression-free survival among the brain met population, and for overall response rate. And that data is not new. The data that's newer was a presentation out of ASCO that showed us of those patients with brain mets, they kind of split those into some different categories. If you recall, HER2 Climb was different in the fact that they didn't only allow patients with stable treated brain mets. They also allowed patients to come on trial if they had untreated asymptomatic brain mets or treated and then progressive brain mets. And so they grouped these into two categories, so-called active, which were untreated or treated and progressive, or stable, which was, or inactive, stable and treated. And so it ended up about 40% of patients were stable and about 60% had active disease. And so in those patients with active brain mets, we saw an improvement of progression-free survival from 4.1 to 9.5 months. And we also saw an improvement in overall survival from 11.6 months up to 20.7 months. So really in a very challenging subset of patients with very aggressive disease and active brain mets, this was incredibly encouraging. Most of the side effects we see with Tucatinib really come from the backbone of capecitabine, the most common side effects really being diarrhea and then hand-foot syndrome. We also have to watch out for LFT abnormalities, but these are really asymptomatic and can be managed with dose holds or reductions.